All right, in lecture 4 of the cardiovascular system, we're going to talk about cardiac output, some of the influences of selected factors on cardiac output, and we're going to talk about blood vessels and their anatomy. So hang on, here we go. Cardiac output is the amount of blood pumped out by each side of the heart in 1 minute. It is the product of the heart rate and the stroke volume. Now, stroke volume is the volume of blood pumped out by a ventricle with each heartbeat. In general, stroke volume increases as the force of ventricular contraction increases. So the normal resting value for heart rate is 75 beats per minute. So we can easily figure out cardiac output with heart rate at 75 beats per minute times stroke volume at 70 milliliters per beat. So that's going to equal 5,259 milliliters per minute. Now that's a lot of blood pumping there. Now, according to Starling's law of the heart, the critical factor controlling stroke volume is how much the cardiac muscle cells are stretched just before they contract. The more they are stretched, the stronger the contraction will be. So changing heart rate is the most common way to change cardiac output. During times of physical or emotional stress, the nerves of the sympathetic division strongly stimulate the SA and the AV nodes and the cardiac muscle itself. So as a result, the heart beats faster. Now, various hormones have a dramatic effect on heart activity also. Epinephrine and thyroxine will increase heart rate. A number of physical factors, including age, gender, exercise, body temperature, can also influence heart rate. Note, not only can certain factors increase heart rate, but they can also decrease heart rate, as those shown on this slide. From the parasympathetic nervous system, some high blood pressure or blood volume can decrease heart rate, and decrease venous return, blood coming back to the heart. All of those can decrease heart rate. So in this figure, we can see the influences of selected factors on the cardiac output, all spelled out for you. Those that increase, those that decrease, all those different things. Okay. Now, blood circulates inside the blood vessels. It forms a closed transport system, and this closed transport system is called the vascular system. It's like a system of roads. The vascular system has its freeways, its secondary roads, and its alleys. So as the blood leaves the large arteries from the heart, they begin to narrow into arterioles, then into capillaries. And so as the blood returns to the heart, they get larger, starting with the venules, then onto the veins. An exchange of gases and nutrients and waste occurs in the capillary beds. Now this shows what an artery looks like and what a vein looks like. Now the walls of blood vessels have 3 coats or tunics, all but the microscopic capillaries. The tunica intima, which lines the lumen or the interior of the vessels in a thin layer of endothelium, right? And remember that is squamous epithelial cells. Yes, please remember that. The tunic media is the bulky middle coat. It is mostly smooth muscle and elastic fibers. This is controlled by the sympathetic nervous system, which is active in changing the diameter of the vessels to allow certain amounts of blood flow to go in or not. So as the vessels constrict or dilate, the blood pressure will change. The tunica externa is the outermost tunic, which is composed of fibrous connective tissue, and its function is basically to support and to protect the vessels. Now this figure shows the walls of the arteries and the veins. As you can see, the capillary is only composed of the tunica intima, right? When we get down to those small vessels, and they are only 1 cell thick. Now the walls of arteries are usually much thicker than those of veins. This is due to the function of each type of the vessels, right? Arteries must be able to expand as blood is forced into them, so they must be stronger and stretchier. Now veins are far from the heart, and the pressure in them tends to be low, so they have thinner walls. Since the pressure in veins is too low to force the blood back to the heart, veins are modified to ensure that the amount of blood returning to the heart is equal to the amount being pumped out of the heart. So they also have larger lumens, or the openings, right? And the larger veins have valves that help prevent the blood from going backwards. We don't want that to happen. Now, skeletal muscle activity also enhances the venous return. So the muscles actually will milk the blood toward the heart as we move our muscles. Now, exchange occurs in the capillaries, so they are only one cell thick. Now here you can see the operation of the muscular pump as well as the valves inside a vein. Now arterial blood uses the heart to move the blood, while veins use this milking action of the muscles as well as the valves to help move their blood. Now the tiny capillaries tend to form interweaving networks called capillary beds. In most body regions, a capillary bed consists of two types of vessels. A vascular shunt is a vessel that directly connects the arteriole and venule at opposite ends of the bed. Now, true capillaries are where the actual exchange vessels. They're exchanging nutrients and oxygen with the surrounding tissues, cells. Now, this figure shows the anatomy of a capillary bed. And this next one here, you can see that the vascular shunt bypasses the two capillaries when sphincters, see, this is the key thing, these sphincters controlling blood entry into the true capillaries are constricted. So when those blood vessels are constricted, boom, the blood just goes straight or right across. So what do we need to know here? For this particular lecture, we need to know the formula for cardiac output and what are the factors that can increase cardiac output. And what are the factors that can decrease cardiac output? A lot of things going on here. Now, what are the vessels involved in the vascular system? What are the differences between veins and arteries? And what is the structure of capillaries, how the structure of capillaries is related to their function in the body? Once you get all that, we're going to be moving on to lecture number 5.